So, welcome to the latest update on the pandemic. So, I'll go through a summary, kind of the status of things, global regions and outbreaks, look at the global models for cases and deaths, as I usually do, and kind of what's changed there. I have a couple extra topics on some countries that actually aren't in the top 50, one of whom will be shortly, probably. And then the US models. And I do have the California county models. Last time in February, I didn't have those fit, but they're included this time. The Santa Barbara County and the local neighboring counties. Then an update on variants and vaccines, and a little bit about the two different flavors of Omicron. And then I'll talk, if anybody really wants to hear about any of the math, I could talk a little bit about an adjustment I made to the model due to the unending timescale of this pandemic, which is stretching the original form of the model. So overall, global daily cases have fallen quite a bit. They were up in January at about 3.5 million a day. They've fallen below 2, but throughout March, they've pretty much hovered between 1.5 and 1.8. So they stopped going down. It's not really clear they're going up again. I mean, they have gone up a bit, but they're not going down when you look at March. Nevertheless, many of the really big outbreaks like the US and India and Brazil are really far, far down from their peaks. Now, I'll show you those. So the places where globally we're seeing case growth, most of the contributions are from Europe and then East and Southeast Asia. And of course, East Asia was the region where the pandemic originally began, and there was originally the largest outbreaks were all there. And it's been very quiet with a few episodes from Japan, really. Other than that, it's been very quiet, and now it's significant again. Omicron remains dominant. There are two main subvariants, 21L and 21K are the next strain clade designations that I prefer to use. You also will hear BA.1, BA.2. We'll look at how and where 21L is continuing to displace 21K, but it hasn't really corresponded strongly with resurgences and outbreaks. Vaccinations are continuing to go up, but much slower than they have been. Daily doses administered globally have fallen about 2/3 since they peaked last summer. Some of the places that are seeing or have seen, certainly with Omicron, big surges in cases had pretty high vaccination rates. Vaccination rates we've reached haven't prevented resurgences. They've certainly continued to moderate both the number of cases and, more significantly, the number of fatalities. And there still is a big difference between low-income countries and high-income countries in terms of vaccination rates. And then, as I mentioned a little bit, I did make an update to the model, and I always want to acknowledge when I make a change to the models we've been seeing. So the change just has to do with the multiple outbreaks that comprise a model. Instead of all starting at the same time and kind of getting smeared out in time with a parameter, each outbreak now has an individual start time. Just allows it to fit better. And at the end, I'll talk a little bit more about it. But other than that, the form of the models remains the same. So these world data were extracted actually from Thursday night data. To get a jump on it, updating all this is hard to do from Friday night to now. So I started on the world with Thursday night data. So this is the progression of outbreaks updated. I stopped really talking about the fact there aren't any 100 case outbreaks, any new countries with more than 100 cases. The main trend has been pretty low growth in the medium-sized outbreaks. So all the outbreaks below 500,000, the number of those has grown less than 6% over the last 2 months. As you get up to bigger outbreaks, the bigger countries are seeing bigger resurgences, and they're moving into these larger outbreak groups. So about 20% growth in the range from 500K to 2 million, and about 60% growth in the outbreaks between 5 million and 20 million. So the big outbreaks, many countries are moving into there. The medium-sized outbreaks, not as much. And nobody has joined the US over 50. The change in the 50 largest outbreaks since the last time I did this in February, Morocco and Cuba, who settled down quite a bit, have fallen out of the top 50. South Korea is back in the top 50, and you can see here it's at number 10. So I don't remember any other country not being in the top 50 in one of these talks and then being number 10 the next time. And as you'll see on the graph, they've had an enormous resurgence in South Korea. And the other one is Norway, which is down here at 49. The other interesting thing that I'll have a chart about is China. China's now 51. So after being basically since March of 2020 being out of the top anything, they're likely going to be back in the top 50 next month. And I'll show a little data on that. So regional changes have been more this period of 6 weeks or so since the last talk than before. So global new cases, I mentioned, fell. They bottomed out about 1.5 million per day and have been drifting up. Europe is about 40% of new cases still. So it's really mostly Western Europe. Less so Eastern Europe or Southern Europe, a little bit Northern Europe, but it's really mostly Western Europe that makes up that 40%. East Asia is about 25%. That's this gray section here. You can see this is, the original China outbreak here on the very far left edge. And then just little blips, this is the Olympics in Japan. Other than that, it really hasn't been a big contributor until 2022, and now it's one of the larger regions. 25% of the new cases in the last 2 weeks came from East Asia. And then the other place is Southeast Asia, this sort of pinkish area, and a little bit in Oceania. The population is pretty small, so on a case number basis, it's not that big, but on a per capita basis, you'll see there's a lot of red in Oceania this month. So looking at the colored map, this is the map from February 4th. So the last time I did this. And again, the making of this map is all the countries are ranked by the number of new cases per million population in the last week. So who has the highest rates of transmission of new case growth per capita in the last week. And then I divide them into quartiles, and the highest quartile is red, then orange, then yellow, and then green is the lowest quartile. Couple things to note as the slide changes to this month. One is the quartiles. Quartiles really went down. So the red in February was a lot more new cases per capita than the red in March. And then the other is what changed and what stayed the same. Europe was red last month. It's pretty red this month. Australia and New Zealand both became red, so they're both in the top quartile in terms of new cases. Southeast Asia, which was mostly green and yellow, now has red spots in it. Of course, South Korea is here. And then China overall changed from green to yellow. The Americas, Chile was red in both cases. The rest of the Americas, there's a lot of orange there. Other than Chile, really isn't any red. So those are the main things that have shifted. South Asia is almost all green. Central Asia is green. That's also an improvement from February. So moving on to the country models, this is the R-squared graph, nothing too notable there. And again, these are data from Thursday. So this is the cumulative cases globally. The black line is the global actual number. The dashed line is the sum of the individual country models. And then the 10 largest outbreaks are the colored lines here. This one up here is the US. You can see it's really flattening out. Overall, the Earth is still a lot steeper than it was last November. It's not as steep as it was in December and January, but it's still significantly steeper than it was pretty much throughout 2021. So the case growth is higher. The majority of these large outbreaks you can see are all kind of leveling off, except South Korea, which is still going up significantly.
How can the U.S. be more than the global?
I'll point out that all the individual outbreaks are on the right-hand axis. So that goes up to 90 million. And then the global number is on the left-hand axis, which goes up to 600 million. So certainly the US is not bigger. It's just plotted on a different axis. So I put these all on the same axis. You couldn't really see what was going on with individual countries. Even the US would all fit within this first section on the global scale. This is the same thing, just to point out the global numbers are here on the left-hand axis and the individual country models are here on the right-hand axis.
Is the U.S. so much higher just because we test so much? I mean, why else would we don't have that much population.
No, I don't think it's just because we test so much. Our case fatality risk is in the upper half. It's in the third quartile, not the top quartile. There isn't a lot of evidence we test way more than everybody else. I just think we have chosen not to manage it the way other countries have managed it, that have big populations and lower per capita case rates.
India, with their population, managed it better than us.
Well, there's probably significant underreporting in India based on serology. Whether they're really better than us or similar to us, I don't know. I'd have to dig into that comparison. Compared to certainly other Western countries that have a lot of testing, our per capita total number of cases is significantly higher than many of them, not all of them. And we are the third most populous country. So our number of cases is going to be higher than just about everybody except India and China if the per capita rates is the same. Looking at fatalities, as I mentioned last month, the slope here it hasn't gone up nearly like the slope in the case rate has. U.S. isn't quite as flat on fatalities as it was on cases, but there is a lag there. For the most part, other places are flattening out similarly on fatalities. And you can see that here, it's kind of stuck around here at 6,000 fatalities a day globally. I'm reading it over here. And this is the U.S. still coming down here. So these are the 5 largest outbreaks. That hasn't changed since February. You can see they're all much lower than their peaks. The 2 in Western Europe, you can see, have turned up. Both the United Kingdom and France are heading back up again, not anywhere near where they were in January, but they're not going down anymore, and it appears to go up. The U.S., India, and Brazil seem to be still heading down and much, much lower than their peaks. And looking at fatalities, if we look at these peaks, comparing the peaks, this is 800,000 versus 200,000, so about quadruple the peak in terms of cases for the U.S., for example. But if you look at the peak in fatalities that corresponds, it's actually lower. And that's being seen across the board. All these places, their most recent peaks were very much larger in terms of number of cases, and their peak in fatalities, none of them have reached a new peak in daily fatalities. As I mentioned before, that's some combination of a less deadly variant in Omicron and a much more vaccinated population than previously. So this is Western Europe, which I mentioned is one of the areas where there's still big contribution to global case growth. Germany hasn't really peaked yet. They're setting new records. They're about 200,000 cases a day. Italy has turned up, looks a lot like France and the UK did, and that came down from their initial peak and are heading back up now. Spain is still down. Belgium may be turning up, but the model isn't fitting it there. Austria still heading up, yet to really start to see declines. And then Netherlands has been very erratically bouncing around between very large different numbers of daily new cases. So it's a little hard to tell what's going on in the Netherlands. But these look a lot different than India, Brazil, and the US, where it's been consistently down and consistently a lot lower than that initial peak. Eastern Europe, which last time we talked, there were a lot of places that in Eastern Europe that hadn't looked like they'd peaked yet. They certainly do look like they've peaked now and are down. Case reporting in Ukraine is not unexpected. There hasn't been any new case reports since 2/24, since they were invaded. So this one, we just don't know what's really going on there. But in terms of the other Eastern European countries, they all seem to be continuing to see declines in daily new cases from their early 22 peak. Similar story in Latin America. Usually, I've mentioned before with Latin America, it's, 2 of them are up and 2 of them are down, and then they just rotate places each month. This time really across the board, starting in Brazil was on the first slide, and then Argentina, Colombia, Mexico, Peru, and Chile, which are the other places in Latin America that are in the 50 largest outbreaks that I track. They're all heading down. Some are very low compared to where they were. And, in the case of Colombia, it's lower than really any other time during the pandemic. So pretty low. And as you remember on the global map, there was some orange, yellow, in a little bit of green in Latin America. Similar story in Central and Western Asia. So Iraq, which of course was an early place with an outbreak and then has had many successfully larger resurgences, is down again back to almost as low a level as they've been in the pandemic. Similarly with Kazakhstan and Iraq. Turkey's still pretty elevated, but declining. South Asia, including India from the first slide, is all quite low, and even relative to their pandemic minima are getting pretty close. So they're not seeing the kind of bounce that Western Europe in particular is seeing. In Africa and the Middle East, I'm not tracking as many because a couple of them, Morocco, for example, have settled out of the 50 largest ones that I track. But Israel, Jordan, and South Africa are all well below where they peaked. So got a whole group of countries and really pretty much entire regions. When you look at North America, South America, Africa, in the Middle East, Central Asia, all those pretty much across the board have graphs that look like this, where there was a big peak in January, and now it's much, much lower than that and still heading down. And then in Western Europe, and then a couple other places you'll see here in, I think, the next slide, that's not true. But in those regions, it's pretty close to universally true.
Israel really took off compared to everybody else. They were all low and then wham.
Yeah, you'll see on the next couple slides some other ones even more dramatic, where you can't even really see the outbreaks until the last one. Like South Korea looks like that. So this is Southeast Asia, which is one of the areas where we're not seeing the behavior like we're seeing in Latin America, for example. So here's Vietnam. Early in the pandemic was really quite a model, had results that a lot of countries wanted to model because they had very little disruption or transmission from the pandemic. Last fall, they had a few outbreaks, and then starting with the Omicron wave, they've really seen very large increases in cases, up to 250,000 cases a day, which looks like it may just be peaking, but, it isn't really heading down yet. Malaysia, very similar, maybe more of an argument that it has peaked and is starting to head down, but just now. Indonesia and the Philippines are down, looking more like many other outbreaks, and then Thailand is looking more like Vietnam and Malaysia. This is one of the reasons that region had such a larger contribution to global new cases this month. And then a few other, outbreaks of interest. Australia, of course, which had the very big surge at the beginning of the year, which unfortunately is right when the Australian Open happens, but it came down, but it certainly looks like they're seeing some resurgence now. They've almost tripled from as low as they'd gotten after the initial Omicron surge. This is South Korea, and you can hardly see any outbreaks, even though at the time, particularly early in the pandemic, they had some of the larger early outbreaks. But this one that they're in the midst of right now just dwarfs them. So it's very hard to even see that they had it before. But they look like they may be peaking around 400,000 new cases a day, which is really quite, it's about half as many cases as the U.S. for a country with a 1/6 the population, a little less than 1/6. So very significant growth in South Korea. Japan, this is the Olympic outbreak. It's kind of coincident with them hosting the Olympics. The most recent, I believe, Omicron-driven outbreak, they're now about half down from that peak. And then Canada looks fairly similar to the U.S., but I like to show them since they're nearby. Did you have a question, Marion?
I'm sorry, I came in late. What is the blue line?
The blue line here is the cumulative cases. So that's the total number of cases. It can only go up. And then the purple line is the derivative of that, or the number of new cases each day. So for all the graphs, it's that same. The blue line on the left is cumulative cases, and the magenta kind of line on the right is on the right scale, which is the daily cases.
Okay. Oh, they're totally different numbers, I see, yeah.
Yeah. So the model fits both of them. There's a whole appendix in the back on that, the math of that. But at any rate, the idea is to fit both the cumulative cases as well as its derivative, which is the daily cases.
What is the little skinny line at the end?
That's the model projection, the dashed line. Yeah, project out about a month. I mean, it's really, the model is just looking at how the change in transmission is changing, and then it extrapolates, says, well, that change continues on that trajectory. What does that look like? So China, this is one of the countries that I thought I'd talk a little bit about. So they're not, they're 51st, as I mentioned, so I don't have them in my main model. But what's been pretty remarkable, this is the Johns Hopkins graph for China. This is the whole outbreak at the beginning where the first detection of COVID-19 happened. And really, they've had outbreaks in the hundreds, very, very small outbreaks through this whole time until 2022. And then now they've got an outbreak that's far larger than what they've had. But it's very regionally specific. My expectation is they'll probably be in the top 50 next time I give one of these. But I thought it would be useful to talk about how that really has evolved in China. So these pie graphs represent for each year how many cases and then how they were distributed among the provinces. So in 2020, the whole of China had about 96,000 cases, which is pretty small. I mean, we've got plenty of counties in California that had far more than that. That was predominantly about over 60,000 of those cases were in Hubei province, where Wuhan is, where the pandemic started. And then second was Hong Kong, and then everybody else. So other than the initial surge that happened when the virus emerged, they had 20 or 30,000 cases other than that big surge, and a third of them were in Hong Kong. In 2021, things were under very good control for the most part, 19,000 cases. Hong Kong was the jurisdiction that had the most cases then, but not hugely out of line with the other provinces, although Hong Kong is one of the least populous places in China. And then in 2022, it looks really different. If you look overall at China, 90% of their total cases have occurred in 2022. So 10% about in 2020 and 2021, including the initial emergence in Wuhan. And of the cases they've gotten in 2022, 97% of them are in Hong Kong. Hong Kong, as it's been widely publicized, has a very big, bad outbreak and problem with COVID in Hong Kong right now. It's somewhat less, although the government is certainly reacting and shutting a lot of things down. I talk regularly with folks with whom I work on that are in China, and everybody had to stop going to the office. And then one guy actually had a contact with somebody who tested positive for COVID, and he not only had to quarantine in solitary. It's just a much more dramatic response that we see, and it's kept things low. But the other thing to remember for the next slide is Jilin province here. So this is the second behind Hong Kong, the second most cases. And it is not a very populous province, Jilin province, compared to many other provinces in China. So it in 2022 is second. China will be probably back, but for the most part, it's because of the number of cases that have occurred in Hong Kong. It's been more than 1 million cases just in Hong Kong, and then less than 200,000 in all the rest of China. The other couple countries I wanted to talk about are two countries that say they have zero COVID. And the question that I was hoping to answer, and I don't know if I really answered it to my satisfaction for North Korea, is does North Korea really have zero COVID cases? So it certainly seems implausible. I also found it very interesting if you look at the map. So there's Hong Kong, which is way far away, but also hugely different in terms of its COVID situation. But compared to the provinces around it, Jilin province, which is the province that shares the biggest border with North Korea, is the biggest hotspot, and it's certainly far and away the biggest hotspot in mainland China. On the other side of North Korea is South Korea, which really amongst all the other countries in the world is the currently biggest hotspot for COVID outbreaks. They had in the last week over 47,000 cases per million, which is the largest of any country. So is it plausible that North Korea has no COVID cases? So I don't think so, but it is interesting how hard it's been to really find conclusive evidence of that. One of the analyses I read, pointed that they do seem to be really taking severe measures. They've closed their borders, and that if they had a large outbreak, a significant outbreak, it would really be difficult for them to manage with the level of their healthcare system right now. So there would be responses that people would expect we would have noticed, which we haven't really seen. It's a little bit unclear or inconclusive. There was one instance in June last year when Kim Jong-un mentioned that there had been a crisis and a failure in pandemic measures, but still didn't acknowledge that they had any cases, but they just had this crisis. My sense is it's just not plausible that there's been no COVID, but it's also, you would expect if it had really been as bad as you would expect, being kind of sandwiched between Jilin province and South Korea, that we'd see more about it. There would be more evidence of it.
Dave, do you know in South Korea whether the recent outbreak came north to south or south to north? Do you have any regional information within South Korea of where the pandemic started recently?
No, I don't. I have to go to the Korea Public Health to see that. The normal data set I look at just has Korea as a single jurisdiction. But that's an interesting question. So the other place that is, similarly kind of a crazily governed place is Turkmenistan. And so Turkmenistan officially has no COVID cases. And similar to North Korea, they've really locked things up. Do they really have no COVID cases? In Turkmenistan, they're not as good at keeping it invisible as they seem maybe to be in North Korea. So clearly they have many COVID cases in Turkmenistan. Officially, cases are not acknowledged. They're documented as pneumonia. It can't be COVID. You can't say you have COVID. They do test for COVID. There have been reports from people in Turkmenistan that they will be told verbally that, yeah, it's positive you have COVID, but it will never be written down as COVID. It's just pneumonia. There are incredible reports of overcrowded hospitals, government guidance urging people to wear masks because of dust in the air. Things like that. It's just clear just like everywhere else, COVID is a significant public health problem in Turkmenistan. And I think that's pretty conclusive. It's a very good BBC article from last September about this, where they interviewed a couple people and had a couple really firsthand reports of how it's managed. So even though Turkmenistan is gray, this is a zoomed in part of the global map that I showed earlier. This number is significantly different than zero. If you look at the places around it, even though they're green, which means their most recent surge is subsiding, there's a lot of cases, 7.1 million in Iran, 1.4 million in Kazakhstan. Turkmenistan, I think, is pretty indisputably has COVID pandemic. Okay, moving on to the US state models. R-squared's nothing really too notable there. So for all the models that I showed up till now, they use that new time treatment that I mentioned in the beginning. I haven't put that into the US state models or the California county models yet. And I'll point out why I want to for next time. So we've developed models for the cases and fatalities for all 50 states and the District of Columbia. The sum of the states models predicts about 85 million cases for the US and about 1 million deaths, which is about a 1.2% case fatality risk, which is pretty close to where it is now. Because almost all the models sort of are settling out. It's kind of what you have now is what the models are saying is pretty close to what we're going to end up with. We have 80 million cases now and 900 and some thousand deaths. So the general trend, this prediction is about 10% lower than a month ago or 6 weeks ago. Death prediction is pretty close to the same. And just about, actually, I can't think of a state that hasn't really declined a lot since the recent peak. So don't see the kinds of things we see in Europe where the new cases are bouncing up again in the US states. And I'll show you some examples of those. Whether I model it as a sum of the states or the individual country, the prediction is about the same. Over the course of 2022, about 8% more, so about 25 million people or cases occurred in 2022. So that's about 30% of all the cases we've had in the pandemic have happened since January 1st. Case-wise, very big. Not as much fatality-wise. So this is the sum of the states models for cases, cumulative cases, and again, the U.S. cases are here on the left, and then the individual state cases are on the right. Everything is leveling out. You don't see anybody really with with much of a positive slope. And you can see that in the daily case graph. All the ups and downs as the outbreaks surged. And you can see here a little bit of why I'm making this adjustment to the time scale. The models are struggling to fit the sharpness of this peak, which is just an artifact of the way I treated time previously that I fixed for the country models. But you don't see anybody bouncing up. Everybody peaked in terms of everybody being each state peaked in January, earlier or later in January, and there isn't much evidence it's heading back up anywhere. These are fatalities. Fatalities still upward slope, not quite as flattening visible as is with the cases. And you can see that in the daily deaths. They aren't down as low relative to the peak as the cases were. Still, fatalities, for the most part, have been under 1,000 a day for the last few weeks, but we're not down to where we were in last summer, for example. So most of these look similar over here on the right, but this is, where I take a look at, well, which states contributed the most to the new cases over the last 2 weeks. And, many of them are the more populous states, and some of them aren't, though. So Texas, California, New York, Kentucky, Nevada, not big on the up high in the population ranks, North Carolina and Illinois, which is pretty populous. The places where they're red and bolded is where they're contributing more cases than their share of the population. So more cases than one would expect. And if it's more than 25% above that, then I color them red and make them bold. So Texas, Kentucky, and Nevada fall into that category. These other ones, we're seeing cases more or less in line with what we expect based on the population. So which states had the most new cases per 10,000? They're colored down here. The red ones are the ones that had the most new cases per capita. They're kind of scattered. It's also interesting to look to remind us where we were in February. This is the February map and then the March map. So Maine was green, one of the lowest in February. Now it's red, one of the highest in March. It's still down way from where it was, but just in terms of rankings in the U.S., a lot of things changed. Kentucky happened to be red on both of them, but Texas became red. Most of the green, the lowest new cases per capita, is in the more rural upper Midwest, North Dakota, South Dakota, Wyoming, Nebraska, and then some in the Southeast. The red, the highest new cases are kind of spread around. I don't know, there's really a regional pattern. So these 7, which I've been sorting through and reporting on for a while, they accounted for about 50% of the new cases, represent about 36% of the population. So that's a little bit more offset that it's been. And the number of new cases is really a lot lower. So if you look at each of these graphs, you can see all of them are down far, far from their peak. And for the most part, flat or down. Really nobody's going back up. Kentucky's a little noisy down here, but there isn't any sign where we start to see the little upturn at the end or a real resurgence. Just not seeing that, even looking at individual states. And when I look at it this way, as I've been doing, where the states are colored orange, if they had more cases in the 7 days before now than they had in the 7 days before that, they're orange. And if they hit an all-time peak in daily new cases, they're red. So early February, we had 23 orange states and 5 red states, 5 states that had hit all-time highs in new cases. This month, we have 5 orange states, which is even kind of lower than expected. That means if things were stable, you'd expect it to be about 50-50, but it's far fewer that are seeing increases. And those are mostly states, like if you look at New York's on here for having more cases. This is their graph right here. And you can see, well, they just sort of flattened out and maybe they randomly had more cases this last week than the week before. It's not really indicative of a resurgence now. The other thing that continues to expand and I think is useful is the sewershed testing that the CDC aggregates. I'm not all that thrilled with how they aggregate it, and the data are really a little spotty. So I'm not sure exactly how well we can infer things, but it should be very much a leading indicator of what COVID testing is going to indicate. It's something I think useful to monitor. So this first map, 15-day percent detection, 85% of the sites are testing positive for COVID virus, SARS-CoV-2 in the effluent, which is down from over 99% in February. Some places it's low enough that they're not actually detecting it in the sewer shed, and that's increased a lot. The number of places that haven't detected it or have failed to detect it has increased a lot since early February. The other useful thing that I think will be the most useful to shore up the data collection and reduction beyond what they have right now is looking at changes. So the levels trending up in this case in 42% of the sites, which is compared to only 25% of the sites in February. Even though it's lower, the rate of change is up compared to early February, but it's still less than half. So it's not clear if this is just, as the virus becomes endemic, we'll continue to see it in the sewer shed, and half of them will be going up a little bit and half of them will be going down a little bit. It's not inconsistent with that state, but it is more trending up in this last week than the case was in February. So I'll keep monitoring that, and they have made improvements in terms of the completeness of the data just even since February. It should be a useful program, I think. On to California. So I missed it last month, but we had successful fitting of the California county models. These are the R-squareds. These are all data from Friday. And this is the way it looks, which is not too dissimilar from a lot of the places, and including the U.S. overall. Cases are really pretty flat, cumulative cases. This isn't much of a slope to the cumulative cases, and that's true amongst all these 10 largest counties. And it's visible in the daily new cases graph. And again, for California, because LA County is so much larger than any other county, it's 25% roughly of the state population. So LA County and California overall are on the left-hand axis, and all other counties are on the right-hand axis. And you can see, again, the model, this black dash line here is the model trying to keep up with this huge spike represented by Omicron. And it, again, because of this mathematical interaction that happens with large time numbers, it can't quite make it steep enough. These are fatalities, and there is a little bit of a issue. This isn't fitting as well as it should. I didn't have a chance to troubleshoot it before the talk, since I just fit these last night, but it's a little bit off in terms of fatalities. But nevertheless, fatalities are curving down and leveling off, but similarly, as we saw in the U.S., not as flat as cases look. And here are the daily fatality numbers, and you can see this is the way that looks on the daily fatalities plot. It's not matching this very well. So I've got to troubleshoot that. But looking at the overall fatalities, they're down quite a bit from their peak. They're under 100 a day statewide, but they aren't down to where they were last summer, for example. So the state overall, these top two are the state graphs for cases and deaths from the U.S. Some of the States model. These are the LA County models from the California Some of the Counties model. And you can see California's comprised 25% of LA, so these look very similar, these two curves. And in both cases, the case peak compared to the fatalities peak is much, much lower. Twice as high, maybe even a little more in cases, and is third as many fatalities, both for LA County and for California overall.
So our case fatality rate in 2022 is like 0.1 or something?
I think it's about 0.2. If I look at the overall cases and then the fatalities that follow it 3 weeks later over this latest surge, it's about 0.2% case fatality risk for the latest cohort. So the state model predicts about 9.5 million cases and 90,000 deaths. It's very similar to the Some of the Counties model. You can see the overall CFR is dropping. So we're adding a whole bunch of cases with a CFR of 0.2, as we just talked about, to the whole other 70% of the cases that had a CFR of 1.2 or 1.5, that even in the overall case fatality risk is dropping. We're still, about 7 times. It's very hard to see on the graph because it spans such a large range of daily cases, but our daily cases still are significantly elevated compared to last summer. So we were down about 500 and we're still about 3,500. So about 7 times as high as we were in the summer. So zooming in a little more to Santa Barbara County, it looks very similar. It may look similar to most of the many U.S. state graphs, and certainly California and LA County. Big peak, not so much peak in fatalities. We got up almost 1,200 cases a day We'd only been at about 400 before, but our fatalities that have been up as high as 6 peaked at about 3 for this surge, 3 fatalities per day. Testing positivities declined down to about 2.4%. It was about 15 to 20% through most of January. It's still not low, just like cases and fatalities really aren't low yet, but it's much lower than it was. Hospitalizations are down to about 20 compared to the peak this time of almost 160, 150, but below the peak in early 2021 of over 200. So much less severe disease experienced during this peak that includes both hospitalizations and fatalities. CFR is about the same as it was last time, and you can see it's in Santa Barbara, we can see the effect of the lower case fatality risk of this recent cohort. The overall case fatality risk for the whole pandemic has dropped by about 1/3 because of that, this latest cohort. We haven't had any more cases at the prison since the last time I talked. So they had a 66 case outbreak in January, mostly dribbled a little bit into the beginning of February. But that outbreak is the only cases they've had between May of last year and now, is that one outbreak in January. If we look at our neighboring counties, they have very similar looking graphs. Kern is a little bit different. It's a little bit more of a inland county, but the coastal counties certainly all have very similar graphs. This little extra bump on Santa Barbara is the prison. On a population basis, we had new cases that represented about 5 to 8%, not dissimilar from the U.S. overall. 5 to 8% of the population got confirmed as a case of COVID in 2022. And overall, Kern is about 27% of their population has been confirmed as a case. And for the coastal counties, it's between 20 and 22. Certainly these very contiguous counties, Santa Barbara, Ventura, and San Luis Obispo, are very similar. Kern is a little bit different. Okay, some updates on variants. So this is the overall clock graph of mutations over time, colored by variant clades. The mean mutation rate is pretty similar to where it's been through the whole pandemic, about 2 a month. I mean, this spuriously precise number that automatically gets generated on this graph changes a little bit from 23 point something to 25 point something, but it's about 2 a month. That's about as much precision as the number deserves. You can see the orange colors here are the Omicron variants, 21K and 21L. This light blue tealish stuff is Delta. Omicron, this graph has been squished a little bit, this one in the lower right-hand corner, to match the timescales. So these correspond, the timescales. This is the global fraction represented by each of the variants, beta, alpha, gamma, delta, Omicron. And you can see that, for a while now, Omicron, predominantly 21K, was displacing Delta, and it is now being displaced by 21L. And we can see in the next one, this one I showed again, I really like the spinning spike protein models. I think the only thing that's really new here is that, it has turned out that 21L, although it has 5 fewer mutations than the 21K almost original Omicron, it does seem to be proven to be more transmissible as it continues in many, many outbreaks to displace the original Omicron. I was interested if, how does that correspond with some of these places that are starting to see new surges? There isn't really a significant correspondence. So these are per variant prevalence plots over time, where each line is a country. And you can see 21K rapidly becomes the dominant variant in the countries. But then shortly after that, almost all countries, it starts going down. And what it's being replaced with, of course, is 21L, which comes on the scene just a little bit later, isn't quite going up as steep as 21K did, but is now broadly going up, in all the outbreaks where it finds itself. And that's this displacement that I've talked about. So I, just as a simple check, I parsed some of the countries into countries that are clearly surging now. So right now they're seeing significant case growth. Australia, Austria, Germany, UK, Korea, Malaysia, Thailand, and Vietnam. So if you can remember all the way back to those graphs, they were all going up. And Yep, for them, 21K is going down, 21L is coming up. But if we look at countries that are stable and low, Argentina, Bangladesh, Colombia, India, Mexico, Pakistan, Peru, South Africa, and the US, it's not a very dissimilar graph. It's not that 21L is now dominant and that surge is subsiding. It's 21L is still growing in both these stable countries as well as surging countries. So it's a little hard, or at least I haven't been able to directly tie some of these resurgences to the actual increase in prevalence of 21L. Now, looking instead of at by variant with all the lines being countries, this is by country with all the shaded areas being different variants. So this lighter purple that's 21L, you can see pretty well, certainly the majority, maybe even dominant variant in the UK, not so much in the US yet, although the CDC look-ahead graph that it has, the nowcast estimate, because of the big lag, I'll show that on the next graph, but CDC puts this number higher, and I'll explain why. France, India, very low and stable numbers, really almost all 21L. And Brazil, low and stable numbers, almost no 21L. So the presence or absence of 21L doesn't seem to be correlated very much with how the outbreaks are going. So this is the CDC information. So this is the nowcast area, where this gray nowcast is above it. And that's where they look at trends, and they have a model, and because there's a big lag getting all the sequence information to be able to assign new cases to variants. And so to try and improve their reporting on how prevalent really is right now a variant, they use this model, and their name for it is nowcast. So they have BA2, BA.2 is another way to say 21L. They have it pegged at almost 40% of the overall country variant population. Not quite taken over yet, not quite 50%, but certainly heading up pretty quickly. And depending on the region, here in the Northeast, it is more prevalent than the original Omicron. Everywhere else, not yet. And here's how it looks in Santa Barbara County, where we don't have a nowcast, so we have to live with the lag and finding out about variants. But the graph is pretty similar. We find most variants in Santa Barbara County. They're found elsewhere in the U.S. It's been Omicron really almost 100% since January. And in March, which you can see here on the number of sequences reported at is only about 30, we're seeing BA.2 or 21L emerging here in Santa Barbara County. Looks pretty similar to the way the overall U.S. graph does, not the nowcast necessarily, but the similarly lagged graph that comes from next strain. These numbers will continue to go up even February and January, that are pretty big numbers. Because some of the sequences come in months later, and these numbers continue to go up. All right, let's take a look at vaccines. So this is another view of pretty similar country list as I showed last time, about percent of the population receiving at least one dose. So there's a big range, large disparity. Some of these up here, Chile, for example, they're down, but they still have a fairly high community transmission rate. They were red in the upper quartile in terms of per capita new cases. China's pretty high. US is here, kind of in the middle. Bangladesh is pretty low. Germany having a resurgence. It is not well correlated in terms of the degree of vaccination and the per capita new cases. You can see Nigeria and Ethiopia here, and that's a general trend. About 14% of the people in low-income countries have received a vaccination. Globally, it's about 64%, which is up about 3% from the last time in early February. It's now crossed 5 billion people that have received a vaccine. But the global vaccine doses administered today has fallen to about 15. It was almost 45 million a day last summer. So certainly continuing to fall. We see that in the US, and we'll see it on the next graphs. These are two maps. These are from Our World in Data, which is a very wonderful clearinghouse for data from good sources that they assemble and make available. This is doses administered per 100 people. So when this is over 2, people are mostly fully vaccinated. When it's over 3, they're mostly fully vaccinated and boosted, over 300. So that's why you have these numbers that are over 100. And you can see vaccination rates in Africa are really quite low compared to almost everywhere else. Pretty high in China, moderately high in the US and most of Eastern Europe, high in Western Europe, Canada, Argentina, Australia, where the degree of vaccination of the population is higher. The other interesting graph they have is not so much the per capita number, but where are the people that haven't received any vaccine by millions of people, not by percent, like who has the highest percent. So the biggest one actually is India, even though India has sort of a middling vaccine delivery percent of people who've been vaccinated. There you have so many people to start with, just a shade below what China has. They're the most unvaccinated people are in India, and then next most is in China. And of course, there are quite a few here and in Russia. So those are the places with the most unvaccinated people in the, call it the Northern Hemisphere. And then here in Central and South, other sub-Saharan Africa, you have some pretty populous countries like Nigeria and Democratic Republic of the Congo that have millions and millions of people that aren't vaccinated. Be very interesting to sort through at the end of the pandemic why it has touched Africa so lightly, given the low levels of vaccination and the fact that there are cases there. And everybody throughout the pandemic has been worried that it'll really be a problem if it gets to Africa, and it just hasn't materialized. I don't really have an explanation for that. So this is the way the U.S. looks. These are percent of the population receiving at least one dose by state. Most of the Northeast is all at about the maximum, which is 95% have received at least one dose. New York, Vermont, Massachusetts, Connecticut, Rhode Island, New Jersey, all per the CDC are at 95%. The lowest is Wyoming at 62%. These are the daily vaccination doses delivered. So they went up high. And then as COVID really started to surge again, they started going up again. They peaked in January, and they're down now lower than they've been any other time really since they were first introduced. So it's about 0.06 per 100 per day vaccination doses being delivered. Across the states, that range continues to grow. It's about 60 to 1. If you compare New Hampshire to North Dakota, which are the current highest and lowest vaccination doses delivered per day, it's about 4 times as big a range as it was in February. And these numbers in terms of who's vaccinated are just creeping up. So 77% of the population has been vaccinated by at least one dose. 66% are fully vaccinated. For the 65 and older subgroup, 95% of them have received at least one dose, 89% fully vaccinated. And in the last 6 weeks, these numbers have just gone up either 1 or 2%. We're really leveling out in terms of our vaccine delivery.
And you're not changing your definition to where, as it's been so long before 2 shots that they and without a booster that you're considered unvaccinated. You're not adjusting for that.
That's right. Yeah, I'm not. This is only, have you been vaccinated at all?
Back to the old definition of a vaccine that you get one and it's good for 10 years.
Yes. Yep, that's clearly not the model for this, I think. In terms of Santa Barbara County, I like this graph, the vaccination and case rates for the vaccinated and unvaccinated population. During the surge, interestingly, this ratio fell to about 3. I mean, it may just be because when things are changing fast, ratios are maybe not smart to do, but pretty much throughout this period, the ratio of how much higher was the case rate in the unvaccinated population, they actually got a little bit closer together. As the surge has subsided, it's back to 4, which is really what it's been. So it's pretty much been 4 times as high a case rate in the unvaccinated population in Santa Barbara. And our vaccine delivery looks very similar to what the U.S. does, and not quite the world is a little different, but in the rest of the U.S. Peaked in the beginning, went up a little bit in the Omicron surge, and is now down to as low as it's been really in any other month except December of 2020. It's down to about 400 doses a day in March. 75% of the population is vaccinated, which is the same as it was in February. It hasn't changed enough to add a digit to that. Population fully vaccinated has gone up 1%. When you look at eligible, it's up to about 80%. I think everybody's eligible that isn't under 5. These are all eligible groups. And 72% of those eligible are fully vaccinated. So as that eligibility group increased now, those that did get vaccinated are now becoming fully vaccinated. It's been long enough. And so that number went up more significantly. But this is how it looks by age group. So just like everywhere else, the vaccination, new subgroups become eligible, they get vaccinated, but to similar or less degree than the existing eligible population.
Any idea what percent of the unvaccinated have caught Omicron and have whatever immunity that gives?
I don't. I haven't. That's, I think, estimable from the county public health data. It's an interesting question. So last slide, or well, second to last slide. So overall comment. So for the current outbreaks, globally estimates a total of about 550 million cases and 6.5 million deaths, which is pretty similar to where it is. The modeled case fatality risk is about 1.1. It's currently, again, aggregated over the whole pandemic about 1.3. This is down a little bit from February, from 607.5 million. So again, assuming the current outbreaks resolve on their current trajectories. Most places really are declining and are pretty low compared to where they were 2 months ago. Not necessarily compared to where they were 9 months ago, but are pretty low. But there still are some regions where cases are going up. Europe, Southeast Asia, and East Asia, most notably. After remaining pretty steady throughout 2021, the case fatality risk is now declining noticeably. Again, the two things hypothesized to be contributing to that are the emergence of Omicron, which is less deadly, and more people getting vaccinated. Last, one little thing just to explain. So anybody wants to object to the math, feel free. Just to tell you what changed in the model. In the old model, there was one start time for the whole outbreak. And as new outbreaks got modeled, this time parameter kind of smeared them out further and further in time. So if you look at the same growth coefficient, they'd look like this. So in order to make them match real outbreaks, I had to keep raising the growth coefficient. See, these are the same total growth coefficient 2 here and 84 here. Now the outbreaks each have an individual timeline that starts. So it's easy with the same growth coefficient, the same time coefficient, they have the same range of outbreak sharpness and asymmetry and all that was in the original model. It just got too difficult because as the pandemic has dragged on so long, to use just one timeline. That's that. So if anybody has any other questions, be happy to answer them.
What are you hearing about additional doses of vaccine or a different vaccine or?
Yeah, I haven't looked at that in a lot of detail. I've certainly heard that the fourth, in fact, I think it's officially fourth dose is authorized for people either by age or compromised immunity. And I have heard both Pfizer and Moderna are working on adjusted mRNA vaccines for the new variants. So, but I'm not sure when those will be ready. I think the vaccine administration, I don't know why it would go up a lot unless there's another surge of something. Just looking at how low it's fallen.
I
Other
think
questions?
I read something today that said that CDC had recommended the Pfizer fourth dose for everybody over 50.
Huh? I know people over 50.
Just came out. I think that just in the last 24 hours.
No, good. Thanks.
Other questions or comments?
I have a question. Do you have any data where you break down death rates by age at all?
So the main data set I have doesn't have data by age. I have to get that from public health departments. You can get that out of the California Public Health Department and Santa Barbara. I'm not sure about the CDC. I haven't looked in detail at that.
Anything else?
All right.